Hello, my name is Julia Lee, and today I will be analyzing the multi-state outbreak of Salmonella Typhimurium infections linked to raw tomatoes. Salmonella infections cause approximately 1.4 million illnesses and 400 deaths annually in the United States. From 2005 to 2006, there were 4 multi-state outbreaks of Salmonella linked to eating raw tomatoes at restaurants, and Salmonella typhimurium was one of the 4 major outbreaks. According to studies, Salmonella originated from tomato fields in Florida, Ohio, and Virginia. People infected with Salmonella typhimurium typically have fever and diarrhea that clear up after about 1 week. Additionally, patients were 34 years old, around 34 years old, 57% were female, and no deaths were reported. Research shows that poor agricultural practices lead to the contamination of tomatoes. A strength is the coordination of multiple state and local health and agricultural departments, laboratories, FDA, and CDC. A weakness is that multi-state outbreaks are difficult to track down and no recall was issued. An opportunity is increasing the number of regulations on fresh produce and improving agricultural and manufacturing practices. A threat is that there is the risk of future tomato-associated outbreaks of Salmonella. The main organization is the FDA, and their goal is to protect the health of the population and ensure the safety of the nation's food supply. In 2006, there were 181 cases of Salmonella typhimurium reported in 21 states due to raw tomato consumption in restaurants. Investigations report that inadequate inspection of tomatoes for bacterium is one of the core issues. In order to reduce Salmonella typhimurium outbreaks, stricter regulations and policies on the agricultural practices must be enacted at all levels of tomato production, from the field to the packing house. An approach is that the FDA launched a tomato safety initiative in 2007 to reduce foodborne illnesses by focusing on food safety efforts. Using the health belief model, if individuals are made aware of the negative consequences of poor agricultural practices and perceive that they are susceptible to infection, they are more likely to see the perceived benefit in taking actions to prevent infection and are more likely to do safe food practices. Alternatively, approaches include reducing exposure of tomatoes to excess amounts of water and stressing the importance of using clean water, as well as decreasing the crop's proximity to poultry farms or certain fungi in the soil. One recommendation is implementing campaigns teaching about safe handling of fresh tomatoes, such as avoiding bruised tomatoes, the refrigeration of cut tomatoes at 40 degrees Celsius, and thoroughly washing tomatoes before consumption. A second recommendation is requiring mandatory farm inspections to prevent future Salmonella typhimurium outbreaks and increase food safety research. The action plan is to increase awareness of food safety techniques by setting up educational booths in front of popular supermarkets in states with higher risks of contracting foodborne illnesses, which will take about 6 months, send agricultural inspectors to large commercial farms to assess the condition of the farms and determine if their produce is safe for consumer consumption, which will take about 1 year, lobby government officials to increase funding on tomato safety research and the Tomato Safety Initiative, which will take about 6 months, and analyze results and determine effectiveness, which will take about 3 months. Overall, the government should take authority and enforce stricter laws to increase regulation of farms and increase the quality of our food. Personally, I love eating tomatoes and never really thought about the possibility of getting Salmonella typhimurium from them. I feel like I have neglected proper safe handling of tomatoes, and I'm lucky that I have not been infected with any foodborne illnesses. After understanding the risks associated with contaminated tomatoes, I will now be very careful when preparing tomatoes and other fresh vegetables.